let's listen to Dr. Yong's webinar on this interesting topic. So over to you, Dr. Yong.
Thank you, Dr. Namtini, for the introductory sessions. Thank you very much. So now let me share my screen now, present my screen for my presentation slides. Okay. So very good afternoon all. I hope everyone are keeping safe and well. Today, I'd like to share some information about the impacts and challenges of research during the COVID-19 pandemic. I do hope that you will be able to gain some fruitful information from this section. So now let us move on to the slides. So what would be the COVID-19 impacts? The coronavirus pandemic has caused profound economic and social disruption across the world. The research is not immune to these changes, and its future is under threat at the moment when investing in science has never been more important. COVID-19 has had tremendous economic, social, and political effects across the world. In the past 1 year, it has seen dramatically rising case and death counts, monstrous job loss, economic stagnations, and ramifying social effects that will felt for years, if not decades. So, what will be the pivotal moment for the research? The COVID-19 pandemic has put scientific research in the spotlight, but is shaking its foundations at the same time too. What does that mean? Let us see in more details. The World Health Organization declared the coronavirus outbreak to be a global pandemic in March 2020. With more than 200 countries and territories affected worldwide, the world as we knew it changed beyond recognition in a matter of weeks. And since then, barely any aspect of society have left undisrupted, and the economic and social repercussions continue to spread as government, business, and populations alike await for a vaccine against and effective treatments for the corona diseases. Science has become mainstream, enjoying the extensive media coverage and influence. The pandemic has also created an opportunity to stymie growing anti-expert sentiments, demonstrating unequivocally the fundamental role played by the scientific research in our society. With an extraordinary show of solidarity, scientists across the globe have mobilized to combat novel coronavirus disease. Yet, for those who could not redirect their efforts to COVID-19, research came to a sudden standstill. This is a bit of a negative impact. So, what would be the impact on ongoing the research? Significant impacts on the ability of researchers to conduct research. And also, the pandemic has reduced access to laboratories, human subjects, and libraries. And productivity depends on the ability to shift the research online. Yet the pandemic's effect on the research enterprise has been enormously disruptive. Social distancing measures have brought many research projects to a halt, slowing down most others postgraduate and early career researchers have been deprived of networking and publishing opportunities and face compelling career prospects. Concern is growing over disproportionate impacts on groups with protected characteristics and the mental health of researchers. On the research information side, COVID-19 has accelerated the shift to digital, but also placed existing infrastructure under the strain. Open access and open data have gained prominence just as library budgets are being squeezed. For university research funding, a double impact is looming. Potential cuts in external research funding, regardless from government or charities, and also regardless of from industry risks, compounding the damage done by precipitous declines in other institutional income streams, including the domestic and international student tuition fees, accommodations, and also the conferences. Okay, so all this will be the part of the impacts. We will have other impacts as well. The pandemic has had a major impact on research productions, from lab and library closure to cancel conferences, like what we just mentioned just now. Only research projects that could be continued online stay largely on track. Negative impacts have had a disproportionate effect on early career researchers and risk reinforcing structural inequalities within academia. So moreover, by undermining the career prospects and financial stability of many researchers, the pandemic may also lead to a reductions in the talent pool with a lasting impact on future research productions. The social distancing measure, as we mentioned just now, in place to address the pandemic has severely impacted on the ability to carry out the research, delaying projects and creating uncertainty around time extensions and also the funding. As lockdown measures ease, but social distancing continues, research remains compromised in terms of access to campus facilities, informations or research subjects, collaborations with partners, and ease of travel. Rapid adoptions of online communication tools has mitigated this, but there are growing concerns over the impact of the pandemic on researchers in terms of mental health and disproportionate impacts for equality and diversity. Universities face significant challenges in opening campuses to students for teaching while continuing to support the research activities in a safe way. This is quite challenging for the management of the university. The level of disruption has been unevenly distributed, however, with striking variations both between and within academic disciplines. So researchers conducting work in laboratories were heavily affected. In many countries, only labs dedicated to COVID-related research were able to remain active during the first wave of the pandemic, and indeed many labs across most of the places and were repurposed to support vaccine research. For projects requiring the clinical research or working with human subjects, physical distancing restrictions have reduced access to patients and population cohorts vital to progress their research. Similarly, research productivity has suffered for academics relying heavily on fieldwork, given restrictions to travels and freedom of movement. For many researchers in the arts, humanities, and social sciences, disruption was caused by lack of access to facilities like libraries or to resources such as the books and also the artifacts. So this would be by contrast, projects that rely more on the desk-based method were less affected. So COVID-19 impact on research productivity depends on the extent to which a project or parts of it can be successfully undertaken online. Many researchers have been able to subject and researchers adapt to using video conferencing software in projects involving qualitative research with human subjects, and researchers with full access to online literature on their subject were advantaged. So, moreover, some studies indicated that a desire to avoid overusing these tools has created growing expectations of preparedness and decision-making, which encourages individual participations and efficient discussions. Digitalizations of knowledge resources, the more flexible blend of online and offline research methods, and use of remote communication tools emerge as key attributes for resilient research projects in a new COVID-19 world. Okay. So now let us move on to what will be the doing research during the pandemic. Offline, like its research is the most affected, and researchers in all disciplines were impacted by COVID. The digitalization of research increased resilience. So this is just part of it that we can just concern on. Okay. So social distancing measures have severely limited the ability to carry out research in all disciplines, delaying projects and creating uncertainty around time extensions and funding. So lab research was hampered by reduced access to facilities. Research involving human subjects was hampered by reduced access to patients and populations cohorts. And academics recycling on fieldwork faced restrictions on travel and freedom of movement, like what we mentioned just now as well. While in the arts humanity society, these are science socials, disruption may caused by lack of access to the facilities. Okay? And COVID-19 impacts on research productivity depends on the extent to which a project could be adapted to these challenges, as well to those of the problems that we have encountered and we have mentioned just now. So researchers at many institutions were first advised to wind down their research activities, and then, with little warning, laboratories were closed. Simultaneously, many clinical studies on disease other than COVID-19 were halted in their tracks. The impacts of research shutdowns will be felt long after the pandemic. Many scientists study diseases that do not share the same obvious urgency as COVID-19 and yet take a shocking toll on human life. For example, malaria. I'm sure every one of you have heard about this malaria. Malaria infects more than 200 million people and takes the life of nearly 500,000 people, mostly young children, each year. So during the laboratory closure without clinical studies, there will be no progress toward treating and preventing malaria, no progress toward a new drugs, vaccines, or diagnosis for the malaria. So there will clearly be a void in direct, measurable research outputs during the following the current hiatus imposed by COVID-19 pandemic. But there will be other impacts that are more qualitative yet equally profound, such as effects on our next generations of young scientists. Many students and fellows were caught off guard by the sudden laboratory closure, ill-prepared to stop experiments on a few days' notice. Trainees give their blood, sweat, and tears to their research projects. They now feel uncertain about their productivity, completing their degrees and building their careers. Although supervisors are trying to keep their trainees engaged virtually, they also recognize the profound impact of lost momentum, a critical driver of research that keeps trainees motivated amid the many challenges and failures in laboratory. Without an end in sight, it is difficult to instill confidence in trainees that pandemic will not have major repercussions on their careers. We also cannot overlook the missed opportunities for international students to gain a valuable experiences abroad. Until travel bans are lifted, there are no viable options for international students. This view especially damaging the students from lower resource countries who perhaps stand to gain the most from international experiences. The Global Scientific Committee will play a heavy price in untap the research potentials. Okay. So the unprecedented shift in funding priorities worldwide and a boom in medical publishings, accompanied by an unprecedented increase in the number of publications. Concerns have been raised about the quality of much of the research and that practice of releasing the preprints of the aggressive of these concerns. So the COVID-19 pandemic hijacked not just a world of long-term care, but the entire world of basic and clinical science, with unprecedented shift in funding priorities worldwide and a boom in medical publishing, accompanied by an unprecedented increase in the number of publications. This accelerated pace of academic publishing has had its own drawbacks. Okay, so let us see. From the slide from these figures, we can see that around 4% of the world research output was devoted to the coronavirus in the year of 2020, and according to the database. But in 2020, also saw a sharp increase in articles on all subjects being submitted to scientific journals, perhaps because many researchers had to stay at home and focus on writing out papers rather than contacting the science, since there's a closure of the laboratories. Submissions to publishers, for example, Elsevier journals alone, were up to around about 55 to 58% between February and May. From these figures, we can see in these few particular months, between February and May, when compared with the same period in 2019. The increase was even higher for health and medicine titles at a whopping of more than 90%. Scientists published well over 100,000 articles about the coronavirus pandemic in 2020. By one count, from this dimension database, they might even pass 200,000 by early of the samples. And more than 4% of the articles listed in the dimension database this year are COVID-related articles. And around 6% of those indexed in the PubMed, which mostly covers life sciences, were dedicated to the topic of this hot issue of the pandemic as well. So at first, the COVID-19 papers focus on the spread of the disease, the outcomes of people hospitalized, and diagnostics and testing, according to one of the analysis of the topic of the PubMed index articles. But this kind of paper mostly become plateau after May, and there has been growing interest in mental health research. The pandemic also feel a sharp rise in sharing through preprints. Okay, the preprints will be another issues for the methods of publications during the COVID-19 pandemics. More than 30,000 of the COVID-19 articles published in the 2020 were preprints, and between 17% and 30% of COVID-19 research papers. According to Dimensions, 1/10 of all preprints this year were about COVID-19. More than half of the preprints appear on one of three sites. For example, the medRxiv, the SSRN, and also the Research Square. And more than 2/3 of all preprints posted on this medRxiv, which only launched in June last year, were about COVID-19. By early December, almost 1/4 of these medRxiv COVID-related preprints have gone on to be published in journals. This has been a pivotal year for preprints that we never seen in the past years, especially as clinicians have become aware of this medRxiv, which many in charge for the preprints methods. And from this one, more than 2/3 of all preprints posted on the medRxiv, which only launched in June last year, were about COVID-19. By early December, almost 1/4 medRxiv's COVID-related preprints have gone on to the published in the journals. So from these figures, we can see that more momentum for preprints have anticipated across the board in 2021 as enthusiasm for early sharing gathered pace. So besides that, what will be the other matters issue arise due to this pandemic COVID-19? Unequal burden advance the output of male authors over female authors, as well the COVID retractions. which is related to the most of the preprint metals that we have mentioned just now. So the pandemic publishing frenzy had winners and also the losers. Although researchers submitted more papers to journals than last year, on average, growth in submissions from female authors trailed behind growth from the male authors across all subject areas, and senior women saw the largest paper penalty. This is probably because women shoulder the burden of childcare and as well the homeschooling during the lockdowns. The same effect was not seen in peer review, where men and women received and accepted invitations to evaluate papers at around the same rate. The pandemic has given incredible opportunities for researchers, but it also has been a shock to the academic system, with an explosion of publications and citations of COVID-19 papers, and this is distorting the rewards of science. We need to make sure these things are taken into account when promoting and hiring in the years ahead, as the retractions issue have been raised up. There were also research publishing scandals. Some high-profile articles on COVID-19 were retracted, including studies that relied on electronic health records from certain companies, which were thrown into doubt after the company said it wouldn't let anyone else to see the health data for auditing. And in total, 15 preprints and 24 journals papers on COVID-19 have been withdrawn or retracted by December. And according to the site Retractions, and this have been volume of coronavirus research, that proportion is about the same as for the research in general. So this also would be one of the issues that we have to be concerned about. And besides that, it is too soon to tell whether COVID-19 papers are any more likely than others to be retracted. And typically, it takes 3 years for editors to retract a paper, but during the pandemic, it has taken just months, in part because papers are facing so much the scrutiny. Retractions are a proxy for attention, perhaps more than anything else. So besides that, there will be a challenging towards this funding restriction as well. So research funding that relies on public fundraising is expected to drop substantially. The global impact the crisis we have on the economy makes it hard to imagine that future research funding will not be substantially affected. Indeed, though government-funded medical research bodies who say they are committed to maintaining the continuity and breadth of biomedical research, how the economic downfall will influence the government's spending remains to be seen. Furthermore, research funding that relies on public fundraising is expected to drop substantially, like what we mentioned, and many researchers will see a significant decrease in funding opportunities. The global impact the crisis will have on the economic makes it hard to imagine, okay, that like what we put in the statement in the slide here, the funding will not be substantially affected. So during this crisis, many resources were understandably redirected toward preparing for and caring for COVID-19 patients. But the collateral damage to so many patients with non-COVID-19 medical conditions that did not receive or fail to seek treatment will surely emerge. Finally, others also pay a high price for the redirecting of medical resources with delays in their medical and surgical management as well as vaccinations. Because we are not only having the COVID-19, but we have other diseases and disorders as well. Thus, it is essential that funding for medical research does not follow the same pattern with a disproportionate decrease in funding for non-COVID research. So we must acknowledge the harm that will be caused by neglecting areas of research that are not tied to COVID-19 and ensure we balance our priorities to save the lives. If we assume that health and medical research are essential to reduce morbidity and mortality, then every month that research is delayed will ultimately lead to increasing suffering. Governments are applying significant funding to COVID-19 related research. However, because of the economic downturn as a result of COVID-19, we fear that government will be tempted to divert funding from the non-COVID-19 research instead of expanding the research budget to accommodate the new demands. This is the most worrying. This is the underlying the worries. So this will further allow the discovery of new treatments, vaccines, and diagnostic for non-COVID-19 diseases. Novel coronavirus diseases has become a new source of human suffering. It is not taking the place of other diseases. So the COVID-19 has significantly impacted the ability of researchers to progress their work. Arrangements for opening campus, facilities for research remain fragile, while there are growing concerns over researchers' mental health and well-being. Institutions, funders, and policymakers must develop strategies to safeguard research capacity, develop and retain talent, and promote diversity for the long term. Alongside funding, this will require the development of new research priorities, methods, partnerships, postgraduate research training programs, and also the career pathway. Clearly, there was a calculated assessment of relative risk for people working in laboratories versus staying at home. And although the shutdown of non-essential laboratory aligns with public health messaging and measures imposed to contain the virus in our communities, we must recognize that this is not a simple formula. Lives are at risk because of stopping research on disease that, in addition to COVID-19, have a major impact on public health as well. Most public funding systems assess research grants based on their potential for impact, and those funded are expected to contribute to healthier societies. Closing laboratories and halting clinical studies undermine this system. We recognize that we are living under exceptional circumstances and that decisions are being made considering the best interests of the public. But we argue that government and academia must allow scientists to resume their work, considering all research essential. Personal protective equipment is already mandated to protect scientists from the hazards of laboratory work. Physical and distancing in laboratories in feasibles and currently implemented in the laboratories working on the COVID-19. Okay, so here we come to the end of the sections. This will be the references that we can refer that related to these topics. Okay, thank you everyone for your time.
Okay, thank you very much, Dr. Yong, for the very wonderful presentation. So, dear viewers, if you have any question or any doubts, you may write your question in the comments below. So, any questions? Okay, so far there is no questions. So we will end our webinar today. Again, I would like to thank Dr. Yong for the very wonderful presentation. Thank you so much. And thank
Thank
you,
you,
dear
Dr.
viewers.
Nantini.
Yeah,
Thank
thank
you.
you.